Thank you for joining Mama Mzazi Talks. My name is Francisca Zanga from Mama Mzazi, Mommy and Me, and we're joined here by the lovely Dr. Teddie Matundura. Thank you for joining us. And today, in honor of World Oral Health Day, we're discussing pregnancy and child dental health care. Yes. So, first things first, what is World Oral Health Day? Why do we celebrate it?
Okay. First of all, thank you for having me again. This World Oral Health Day is a day that's celebrated, it's on the 20th of March every year. Basically to sensitize people on matters about oral health and oral hygiene. And also it helps institutions like governments to implement measures which will also promote the oral health of every society.
Okay. And so it's celebrated globally?
Yes, it's global.
Okay, all right. And when we go into now the pregnancy and dental care, are expected mothers more susceptible to getting dental problems as opposed to the everyday woman?
Yes and no. Yes, in that hormones play quite a significant role. In pregnancy, the hormones are different. The hormonal levels are different than from, let's say, a woman who's not pregnant. And also the habits that surround the pregnancy, like for instance the cravings. So women tend to snack a lot during that time.
Yeah, the chocolates or the at night, midnight snacks and all that.
Yes. So yes and no, in the sense that you don't have, just because you're pregnant doesn't mean you have to have oral health issues. If you take care of yourself, you'll be fine, unless otherwise indicated by a medical practitioner. Okay,
alright. Yeah. And what about when it comes to things like supplements, like calcium supplements and all that? Do they also play a part in the dental care of the mother?
It does. Calcium strengthens teeth and bones. Okay. So it will help during the pregnancy.
Alright. Okay. Alright, so moving on to the children, because dental healthcare is something that's also oral healthcare is very important from early childhood. There's something called tongue tie. Would you mind explaining to us what that is?
Basically, in layman's terms, if you raise your tongue, there's an attachment of, let's say, a muscle underneath there, underneath the tongue. So the positioning of that, it's called a frenum. The positioning of it really, now basically, if it's not positioned properly, then that's when the tongue tie occurs.
Okay. Yeah. So we do have some images here. So the frenum is this part here in the middle.
Yes.
So what causes tongue tie?
It's congenital. So there's not really, it's not someone's fault for the baby getting the tongue tie. It just happens.
Okay.
Yeah. And not for every person.
Not every child.
Yeah, not every child. Yes.
Okay. And what are some of the effects that can come about if a child does have tongue tie?
Difficulty in feeding, difficulty in speech later on. So feeding is a major issue when it's a newborn. They need to feed well. You'll notice that the baby is not suckling as well as they should have. Yes.
And that's because of the tongue position, I assume?
Yes.
There's a certain position the tongue needs to be during breastfeeding?
Yes, there is.
Okay.
Not the tongue position per se, it's because the child is not able to push. There's some limit to how far the child can push the tongue because it's held back. So it limits the feeding ability.
Okay. And does one go about correcting such a condition?
Preferably this is done as soon as it's noticed. In fact, we are trying to implement that mothers in the 6th week, when you come for a review to your doctor, that this actually an oral examination is done to check for anything that could be amiss in the mouth. So at this point it can be released. You don't even need to give anesthesia to the child. It's just released. The baby will cry for a few minutes. You give him or her to the mother to breastfeed, and the baby is fine.
So it's something you can actually very easily notice when you just lift up the tongue.
Yes.
Now, what do you mean by released? Is that they cut? What do you mean by released? Okay. Okay.
Yeah.
Okay. So it's just a quick snip?
Quick snip.
Can someone do that at home? I mean,
no.
Okay.
I would not advise that.
Okay.
Yeah.
Now, what about those ones who might not be able to afford? I'm assuming you have to pay for the procedure. Is it?
It's not an expensive procedure, and you can go to a government facility.
Okay.
Basically, these things in the government now, it's almost free.
Oh.
All you need to pay for is the book and the tongue tie is released.
Okay.
Yeah.
Okay. And now there's two sets of teeth. There's the neonatal and then there's the antenatal teeth.
There's natal and neonatal teeth. The difference is that teeth that are in the mouth soon after birth and the ones that are in the mouth at birth. Which this is a bit of an anomaly because we start seeing teeth in the baby's mouth at about 4 months, 5 months, or later on. So this can tend to really tense up the parents. You know, with the culture, people tend to think, oh, my baby's, there's witchcraft involved. But it does happen.
Okay.
Yeah.
So the neonatal teeth are the ones that are there, they're there at birth?
Yes.
Okay. So what do you do with such teeth? Like, how do you, is it something that needs to be corrected?
If it's preventing feeding, the biggest problem again is feeding.
Okay.
So if it's preventing feeding, then we remove the teeth. But if the mother is comfortable, we leave the teeth in the mouth.
Right. And will they, do they go through the normal process where they grow, they come off, then you have another set of teeth?
Yes.
For the neonatal teeth, do we expect the cycle to be a bit longer, considering that these teeth were already there at birth?
They may exfoliate earlier than they should. Within the time, about 4 or 5 years, they may exfoliate earlier. But many times, these teeth are removed, again, as I said, because of the feeding issues.
And if you remove them because of feeding, will this child have to wait until maybe 5 years before they start getting teeth?
Yes.
So they'll grow that whole way without actually having.
But you'll notice many times it's not the whole mouth. It's just maybe a few teeth on the bottom. So they'll survive.
Alright.
Yeah.
What are the basic hygiene habits that one needs to develop when it comes to taking care of the child's teeth?
I would advise mothers to start cleaning their mouth as soon as they can. Because the child is eating. Feeding. Let me say feeding because it's the milk. If you notice, many times you'll see a child with the tongue has a thick white layer, or even yellow. That's because of the milk. This needs to be cleaned off. Many babies have bad breath, halitosis, and because the mouth is not being cleaned. So as soon as you can, start cleaning the mouth, and you can take, actually my doula is the one who advised me on this. You can take a clean cloth, you boil it, make sure you have clean hands, obviously. Wrap it around your index finger, then just do a sweep inside the mouth. The baby will tend to suck your finger. And if the material is a bit coarse, it also cleanses the tongue.
Okay.
So that by the time the baby gets teeth, they're used to something being in the mouth because it becomes quite a battle. Now, when the teeth come into the mouth, you start introducing the toothbrush. Babies don't usually respond well to that. So, but since they're used to having the mouth cleaned, it's quite easy. And for the natal and neonatal teeth, there are teeth in the mouth. So you need to clean them from the word go. Yes.
So as soon as if the baby has neonatal teeth, as soon as they're born, start cleaning them.
Start cleaning. And no putting of salt. Just boil the cloth, let it cool, wrap it around your index finger and clean. But once the teeth are in the mouth, you can introduce a toothbrush. The appropriate age and the appropriate toothpaste. Quantity is critical because babies tend to swallow. So the size of a rice grain is enough. Just a rice grain. Yeah.
Okay. Right. And so let's go into another common condition at birth, and that's the cleft lip. So what exactly does it mean when they say a child has a cleft lip?
I will combine this. There's cleft lip, a cleft palate.
Okay.
And a child can have both or just the cleft lip, and separately another child can have cleft palate.
So they're two different things?
Yes.
Okay.
But they can be both in one mouth, one child.
Correct.
So the cleft lip is basically a communication from the lip it can communicate to the nose. Again, it can communicate into the mouth. For the cleft palate, it's a communication on the roof. There's an opening at the roof of the palate, like to the nose. Yeah.
In this case of the image that we have here,
That's a cleft lip. Huh?
okay.
But we need to have, for this image, we can't see properly. Most likely this child also has a cleft palate.
Okay.
Yeah.
Okay. Alright.
So for this, I would advise parents immediately the child is born and you can see a maxillofacial doctor, maxillofacial surgeon immediately. The results, it can be corrected. The results are much better when it's treated in an infant than an adult. Yeah.
And what are some of the side effects? Like, what are the effects of actually having a cleft lip? I know for obvious reasons there's the feeding.
There's feeding, there's the aesthetics bit, there's speech. Yeah. And generally, can imagine a grown-up walking around like that. The aesthetics bit of it have quite some huge psychological effects on the child when the children, the kids are mean, yeah?
Yeah.
So this needs to be corrected quite early.
Okay.
Yeah.
Is it an expensive procedure?
I wouldn't say it's expensive because, again, you can go to a government facility and it's sorted out. And there's also something called a smile train, so which occasionally do these procedures for free.
Okay.
Yeah.
Where are they based?
We have smile train in Nairobi. In Kenya we have different centers. Yeah.
All right. Let's move on to malpositioning of teeth. What does that mean?
As the word suggests, it's teeth can be ill positioned. Instead of being in the right position in the dental arch, they're positioned wrongly.
So you have some images here. So could you describe to us, like the first one, I think it's very clear. There's some additional teeth growing, and in image A. What about image B? I don't know, I think all of us have maybe like one tooth that's crooked. Is that normal?
Now, for the first image, I would not say that there are additional teeth. And this is parents really come tense about this, the first image A.
Okay.
These are the permanent teeth coming into the mouth, but the baby teeth are not yet exfoliated. So parents should not worry about this. Just take your baby to the dentist. We will remove the teeth that we'll analyze and see which teeth we need to remove. In the second image, actually, it's the same patient. So the baby teeth have been removed, and as you can see, the tongue actually pushes the teeth into position.
Okay.
Now, for the second picture, there's still crowding, as you can see. So later on, the dentist will also decide when we need to remove other baby teeth to create space.
Okay.
Yeah.
All right. So going now back to my biology in high school, we were told every tooth had its purpose. So what happens when you remove like certain teeth?
In this case, we see we are just removing the baby teeth.
Okay. So the other teeth will grow properly with whatever space.
Yes. However, there are some instances where we remove when the child is a bit older, and we can predict that there are going to be issues with space. So there's something called interceptive orthodontics. So for that, we can sacrifice some teeth, mostly the premolars. One on each side, so that will be 4 premolars. But again, the dentist will decide whether we usually remove a tooth that is nearest to the issue. Like if I see crowding in a certain area, I cannot remove a tooth from a place that's too far from the crowding.
It needs to be near the area where there's a problem.
Yes.
Okay.
So basically, yeah, that's it.
There's something you said earlier. I want to go back to that. You mentioned that you decide, like on image A, you will decide which tooth to remove, whether it's the baby teeth or the permanent teeth.
No. Never remove the permanent teeth.
Okay. So it's always the baby teeth.
The baby tooth that is sacrificed.
Okay.
In this case, we'll remove a permanent tooth when we can foresee that there will be an issue in the future.
Okay. Moving on to another dental problem that I've heard some parents talk about, which is fluorosis. Now, what is fluorosis?
Fluorosis is, to make it easier for people to understand, I will refer to like people from Nakuru, Naivasha, you'll see a certain browning of the teeth. And here in Nairobi, you'll see even the children around Utawala areas, some places like Langata, you'll notice that the teeth are a bit brown. And it will depend on the amount of exposure to the fluoride. It's caused by high fluoride content in the water.
Okay.
So like in this picture, it's the different, depending on the amount of exposure, yeah? If it's excess, you'll have the severe. If it's just a little bit, it'll be very mild. Okay. So I would advise parents who live in areas that they know they're using borehole water, the water has not been tested. Just you need to get a filter. You need first of all your water tested to find out the mineral content of the water, and obviously to analyze what other things are in the water so that it's safe for your children to take. Then from there you can get a filter made for you that is specific to the water in your area. Because the water filter that, for instance, I may use in Athi River is not the same water filter that I use in Nairobi. Specific parts of Nairobi, that is. So it needs to be analyzed. And it will affect even if you're growing your vegetables with this water, if you're washing your vegetables with this water, if you're cooking with this water, the child will get fluorosis. But an adult will not get fluorosis because the teeth are already developed. So this affects developing teeth.
Alright.
So even pregnant women should not take this water. The tooth germs are in the mouth already, even when the child is in the uterus. So once a child is born, you may notice the browning and you're wondering, I don't give my child sweets. I don't do. Many parents tend to think it's the habits, but it's because of the water.
Now, can fluorosis, and I'm sure a lot of parents right now are crossing their fingers, can you reverse the effects of fluorosis?
We can't really reverse, but we can manage it.
Okay.
Depending on the severity. We can do bleaching, we can do a procedure called masking, which is basically just removing of that layer that is fluorous and putting another one. We can do something called veneers, but it's dependent on the age of the child. We have to wait for the tooth to develop. Or if the parents want it done, we can do it when the child is younger, but they need to remember, once the tooth has fully developed, we still need to repeat the procedures. Yeah, but something like bleaching is not a permanent thing, because the fluorosis, you'll notice after a couple of years, you'll notice the effects, or still notice the effects of the fluorosis. Yeah.
And there's something you mentioned there where parents always assume that the fluorosis is actually due to poor oral hygiene. Why do you think most parents confuse that? What are some of the similarities when it comes to the two?
It's just a mindset, in my opinion. Because you see something brown, you think it's dirty. It's just basically the mindset. And also they'll tend to think, I don't have it. Me as a parent, they may not have information that this will not affect them, but will affect their children. So they may think, I don't have it, but my child tends to, may not adhere to the oral hygiene practices as they should. So maybe the child has it. It's just a misconception. Okay. Yes.
So, and we have some images here of
dental calculus and tartar, yeah?
Okay.
So if you don't brush, there's usually this white material that forms on your teeth, which can be wiped off. If it's not wiped off in time, saliva has minerals. Yeah? So the minerals in the saliva will harden this dirt, and it adheres to the tooth and it becomes hard like stone. So many times these individuals tend to have bleeding gums, because even in the picture you can see there's a bit of red in between that. So this is because basically this person is not brushing.
Okay, so now this one is actually due to poor oral hygiene. It has nothing to do with fluorosis.
No, this is not fluorosis. And this, now you have to come to a dentist. You'll need the procedure known as scaling, where we clean off all this dirt. We get into the spaces and clean it off well. The dentist at that point will then give you oral hygiene instructions on how you should clean and put you on a sort of maintenance program, so that this does not recur. But you need to have the cleaning done at least once or twice a year, even if you're good at your cleaning. Yeah, even if you're good at your brushing.
Now, I want to show us another image because we discuss, we've talked about the oral hygiene and the effects that has on the teeth. What about habits that people pick up, and children especially, sucking your thumb, grinding your teeth, and different kind of habits. Like, we do have an image here as well. So what are some of the habits that might have caused this?
The major habits that we are concerned about are tongue thrusting, putting the tongue as the image shows.
Okay.
And also thumb sucking. And this is a habit that should be nipped in the bud. Because the more the tongue, if you're sucking your thumb, you tend to push. There's a pushing motion. Okay. So the person will tend to have somehow like an open bite. And also with the tongue, you're also pushing the teeth. And you'll see a characteristic, like a round oval opening, the front of the mouth. This can be corrected. However, it is easier. But before we correct, the habit has to be stopped. Because even if this child definitely needs braces.
Okay.
Definitely. But we can do braces and then they go back to the habit. You see, we'll be doing zero work. So it's advisable to stop the habit. A dentist can have a habit breaker fabricated. And also just, psychologically, the parent needs to keep on, reminding the child. The child should not be punished. But the child should be constantly reminded, told the effects. Yeah. So the child needs to accept that this is a bad habit first. Then we also need to make a habit breaker. Then do the braces to correct that.
Okay. All right. So you mentioned about a habit breaker. What is that?
As the name suggests, it's a device used to stop the habit that the child has, be it tongue sucking, tongue thrusting, nail biting, whatever. So basically it's to stop, because these habits, again, as I said, they are detrimental to the teeth as they are developing. Yes. Okay.
So how exactly does it stop the habit?
Some, actually, we can put a device maybe on the upper jaw.
Okay.
So every time the child puts their thumb in the mouth, it kind of hurts the thumb or the tongue, whatever it is, because you will find even a tongue thruster may do it at night when they don't know. Yeah, not something that you can just buy. But there are some devices actually that, like for the thumb sucking, the child can wear something on their thumb, which will prevent them. It will deter them from putting the thumb in the mouth.
Okay.
But you still need to go to a dentist
to have it put.
Yeah.
Okay. And so we also have something called early childhood caries, which for a layman like me who's not a doctor actually looks like fluorosis. I would confuse the two. But what exactly is early childhood caries?
Early childhood caries is also known as breastfeeding caries.
Okay.
Mothers tend to, mostly at night, you get up, the baby cries, you get up, pick the child, maybe the baby sleeping in the crib or something, and you breastfeed. Then somehow both of you fall asleep. The child will continue sucking, even if the child is asleep. And breast milk is sugary. So the child will tend to get carious lesions, that the teeth start to rot because of the sugar in the breast milk.
Okay.
So the mother needs to remember, make an effort. Breastfeed, put the child down, go back to bed. Yeah.
And so with our images here, we have actually two images of childhood caries. What is the difference between the two?
One is a less severe form, the other is a more severe form.
So is it like age-wise? Is it maybe dependent on age? How frequent can one go from this to this?
It depends on the amount of exposure.
Okay.
Maybe this parent just does it for maybe during the day. The child should be watching TV or something, the child is there. But then you can imagine if the mother is doing this the whole night, this is when you'll end up with this second image.
How do you treat early childhood caries?
If the child is not in pain, if there is no abscess, many times we leave the teeth as they are.
Even when they're in this stage?
Yes.
Okay.
Unless the child is in pain.
Okay.
Now, it gets to a point where we just have to remove the teeth.
Okay. There are a lot of concerns that parents have on when it comes to, like, some of these conditions need maybe some kind of procedure to be done. How can you make sure that you have a qualified doctor diagnosing the condition? Because as we've seen, for me, a layman, some of these conditions actually look the same. I would think childhood care is actually fluorosis. So how do you know that you have a professional, trained, certified doctor actually taking care of your child? As opposed to maybe someone who's not as qualified or not in a position to actually care for your child.
So the first thing the parent needs to do is to, there's a doctor's register. The Medical Practitioners and Dentists Board has made it accessible online. So you just need to Google that, the Medical Practitioners and Dentists Board register, type in the name of the doctor, and you'll see whether they're in the register or not. And you can even see their specialty, their subspecialty. So for this, maybe if it's a qualified doctor and not in the register, maybe they've not paid for the annual subscription, but many times you'll find. So for instance, for myself, if you Google first of all you start Google the Medical Practitioners and Dentists Board register, then you can check out my name. Just type in my name and you'll see. The year of graduation, you'll see so many details on that. And it's quite simple actually. And you can even ask your doctor the qualifications. But it's safer to just look at the register.
Okay, all right. So thank you so much, Dr. Teddie, for joining us today. And for our viewers at home, my dear mothers and fathers at home, if you have any question on child dental care, or if you're expecting and you want to know, you have any concerns about your dental care, you can always leave a question on the comment section and we will be there to answer it. So thank you again for watching and thank you for being here.
Thank you for having me.